Biodiversity and Health in an Urbanizing World. Actually, the first workshop on health and biodiversity was carried out at Universitas Indonesia in 2018, and the second workshop was done at Universitas Gadjah Mada, and today it will be the third workshop. I would like to thank Professor Maria Yazdanbakhsh for initiating and organizing the workshop. Uh, Professor Yazdanbakhsh and I will share to chair this session. I will give the floor to 8 scholars from Indonesia and the Netherlands who will present in escalator pitches of maximum 4 pitches their research related to health, to biodiversity, to urban studies, and to show the potential of such a consortium. I hand the screen to Dr. Katja Polman to start the pitches. Next slide, please.
Good morning, everybody. Next slide, please. I am Katja Polman. I work at the VU University in Amsterdam as Associate Professor at the Department of Health Sciences in the section of infectious diseases. Our research and education is in the field of infectious disease epidemiology. One of our main current research topics is on the interplay between infection and nutrition and the impact of human health and disease. In Indonesia, we have strong collaborations with the Gadjah Mada University in Yogyakarta, in particular with Dr. Yodi Mahendradhata and his team, and with the Center for Tropical Medicine. Next slide, please. As I am the first speaker of this session, I will first give a short introduction on the theme of our session. Indonesia is urbanizing at a rapid rate, resulting in a wide variety of rural and urban areas, ranging from extremely poor and rural situations at one end to fast emerging megacities at the other. The Netherlands is already a highly urbanized country and is placed more towards the right end of the spectrum. And the variety is smaller with less extreme situations. With increasing urbanization and related changes in socioeconomic status, living environment, lifestyle, and other factors, disease profiles are changing. For example, communicable infectious diseases become less prevalent, whereas non-communicable disorders such as allergies, obesity, and cardiometabolic diseases are emerging. At the same time, urbanization leads to loss of biodiversity, which can destabilize ecosystems and negatively influence health. This can, for example, promote outbreaks of infectious diseases and undermine nutrition. There's also evidence that loss of biodiversity is linked to the modulation of the human health through changes in the microbiome, and that high species diversity has been associated with both reduced and increased vector-borne disease risk. By studying the transition from rural to urban living, biodiversity change, and human health, it might be possible to find innovative solutions to diseases affecting both Dutch and Indonesian populations. This will be the central theme of this session. Together, the Netherlands and Indonesia can form a very strong partnership for dealing with one of the major global health problems, urbanization. Next slide, please. Within this team, our group at the VU University in Amsterdam would focus on the triple burden of disease. Due to urbanization, Indonesia is a country in epidemiological and nutrition transition. Indonesia still struggles to reduce infectious disease burden. The country also has to cope with emerging and re-emerging infectious diseases. The prevalence of child undernutrition and stunting is still very high, and overweight, obesity, and related non-communicable diseases are rapidly emerging. Next slide, please. To address this triple burden of disease, our group could contribute by unraveling the spatio-temporal dynamics and driving factors of infection, nutrition, and NCDs in urban, semi-urban, and rural areas. By assessing the role of parasitic infections and intestinal microbiota and the dual burden of undernutrition and obesity and NCDs, and by understanding the association and interaction between human living conditions, meaning the built, natural, as well as the social environment, and the emerging and re-emerging of infectious diseases. Our final aim would be to design systemic, sustainable interventions thereby making urbanizing settings more resilient to these multiple challenges, and as such contribute to healthy urbanization. Thank you. Next slide, please.
Good afternoon, everyone, and also good morning for our fellow colleagues in the Netherlands. My name is Dicky Tahapary. Next slide. Next slide, please. So in Jakarta, we work together from, sorry, previous slide. We work together with the local health authorities from Jakarta, and also we work with the hospital, Cipto Mangunkusumo Hospital, as well as the all-round hospital that work in under the system of academic health system in Jakarta. And we also have a close collaboration with the LUMC. So what we are very interested in is actually want to compare the health within urban and rural. So if you compare the environment, comparing, for example, Flores as a rural area and Jakarta as an urban area, there is a huge difference in terms of environment, in terms of lifestyle. And we have previously studied that different in lifestyle and break with natural environment and biodiversity appear to be associated with changes in immune system and might result in various adverse health effects. For example, our previous study in the immunology aspect, we shown that if you compare the immunology of the people living in Flores area and compared to the one who live in the urban area of European, you can see there is a huge difference in terms of cells that produce the cytokines that is more anti-inflammatory. And this difference in terms of immune system might also affect the development of disease, as well as in non-communicable disease and also infectious disease. So in Indonesia, the geographical and biodiversity variations exist in terms of non-communicable disease and infectious disease that might stem from the difference in immune system because we have different biodiversity and also environment. Next slide. So if you look into the main pathogenesis of non-communicable diseases, insulin resistance has been the main pathogenesis. If you look into the cause of insulin resistance, it can cause by epigenetic and also genetic, but the two main factors is actually environment, also inflammation or immune regulations. And this will then lead to insulin resistance, will lead to obesity, hypertension, type 2 diabetes, cardiovascular disease, and cancers, which leads to mortality. And now we already shown as well that COVID-19, for example, is associated also with immune system as well. And we have seen a lot of studies have shown that actually non-communicable disease also increase the risk and severity for COVID-19. So although genetics have a major impact on the immune system and disease susceptibility, the contribution of environmental factor is thought to be substantial. So the difference between anti-inflammatory and pro-inflammatory immune system might also affect the risk and severity of COVID-19 and also non-communicable diseases. Next slide. So what we want to study is actually our group, we will test the hypothesis that environment and lifestyle changes, which are associated with strong modulation of immune response, are associated with the development of cardiometabolic diseases and potentially influences the COVID-19 risk and severity. So we will working together with a lot of scientists, not only from the medical background, but also from social science, trying to unravel the mechanism. Thank you.
Next slide. Hello, everyone. My name is Yodi Mahendradhata. I'm from Gadjah Mada University, Indonesia. Next slide. Okay, let me take you to my hometown, Yogyakarta, where we are trying to prepare to set up a long-term collaborations with our local authorities, the local health office, and also Free University Amsterdam, to be able to address an imminent challenge. I mean, Yogyakarta used to be a small campus town for many years, but in the past decades, it has been growing rapidly as an urban setting. Next slide. So it has been growing as rapid as many other cities in Indonesia, much faster in other Asian countries. And with that comes multiple health problems, as we can see. For example, we know that for sure, adult life expectancy is much lower in Indonesian urban settings. And behind this, we see that this is because urbanization promotes several conditions which are more conducive to malnutrition, more conducive to unhealthy lifestyle leading to non-communicable diseases, but also conditions which are conducive to the spread of communicable diseases like dengue, TB, and even MDR-TB. And what we're seeing in the past few months during the pandemic, we're also seeing that the urban poor, not only they are the most susceptible to the health risk posed by COVID, they're also the one who suffer the most from mitigation measures like lockdown or other restrictions. So it's an imminent problem that we would like to address. Next slide. So we are at the stage where we think we should start at least to design sustainable interventions to make our urban settings more resilient to the triple burden of infectious diseases, malnutrition, and NCDs. Now we know this is a complex problem, a wicked problem, so we don't pretend we'll be able to resolve this with simple interventions in the coming months, but we do believe we can make substantial progress by doing things a bit more systematically. So what we have in mind is a multi-year project divided into two phases. The first phase more for designing, starting by defining, understanding problems, the factors, and the theory of change. And the second part more about testing and refining it on a small scale and collecting evidence for implementation and scaling up. Now, this is going to be a complex undertaking, so we have to have the right players, the right disciplines in place. Next slides. So here we are quite fortunate that we have more or less the required and needed players and disciplines. We have the infrastructures, we have the research centers, we have the implementing partners in Yogyakarta. So for example, in terms of infrastructures, we have in place for many years now our biobank, our demographic surveillance system, and integrated research lab. In terms of centers, we have the tropical medicine centers, the human nutrition, health behavior, and health policy and management. And we've been collaborating for many years with the district health office who are coordinating the primary health care centers, who are at the front line in terms of urban health. And they've been working for many years also hand in hand with non-governmental organizations. So again, it's a complex problem, but we are convinced, we believe that we are well positioned to actually make some significant progress to make urban setting more resilient to triple burden of diseases. Thank you. Next slide.
Hello, everyone. My name is Kerstin Klipstein-Grobusch, and I'm an associate professor of global health at the University Medical Center Utrecht. Next slide, please. Our global health activities at the University Medical Center focus on the dual burden of communicable and non-communicable disease, environmental health and exposome in Southeast Asia and in Sub-Saharan Africa, and on research capacity building in epidemiology and public health through blended learning and PhD level training. For the past 15 years, the University Medical Center Utrecht has been collaborating with Universitas Hasanuddin in Makassar and Universitas Indonesia in Jakarta. At the Universitas Indonesia, the collaboration has facilitated the development of the clinical epidemiology and evidence-based medicine unit. Next slide, please. Globally, we observe rapid urbanization in many lower middle income countries, including in Indonesia. Environmental and lifestyle changes are intertwined with socioeconomic development and urbanization. Environmental exposures during key periods of the life course have been shown to affect susceptibility to disease. The so-called development of health and disease DOHAT framework, very nicely depicted in this Time article, facilitates the study of early life determinants on health throughout life that can be used for development of prevention and intervention approaches towards better population health. Next slide, please. For our joint collaborative work with colleagues at Cipto Mangunkusumo Hospital, we have set up a research platform to undertake DOHAT framework-guided maternal, neonatal, infant, and child health research. Two major projects relate to early signs, relate to pregnancy and birth cohorts that have been set up to study the effect of breastfeeding on early signs of later chronic disease, and to investigate the effect of environmental exposure, specifically air pollution, considered a major problem in Jakarta, on maternal and child health outcomes. Our research platform has received substantial financial support amongst through universities, but also international funding organizations like USAID. It can easily be used and can easily be extended towards new research topics and for long-term follow-up of mothers and their children. Next slide, please. To give you an idea of current research in urban Jakarta, studying the relation of environmental exposure and pregnancy for infant and child health, I like to highlight current work undertaken by one of our PhD students, Frida Susanti, a pediatrician at SIPTE Mangunkusumo Hospital. Her work shows outdoor air pollution, secondhand smoking, and also the use of household pesticides to be associated with reduced birth rate, respectively low head circumference at birth and 6 months of age. Her findings point towards addressing environmental determinants for better individual and population health. Now, the collaboration to date has been supported by many colleagues, both in Indonesia and the Netherlands, and we do look forward to future collaboration with the universities. We already work extensively with Universitas Hasanuddin in Indonesia, and of course, beyond. Thank you very much.
Okay, my name is Hermelijn Smits. I work at the Leiden University Medical Center. Next, please. I work at a Center of Infectious Diseases together with Professor Yazdanbakhsh, Dr. Sartono, Dr. Jochems, and Dr. Tuck, and we are interested how microbial exposure is influencing the immune system. We do these, we study those research questions together with Universitas Indonesia, with Professor Supali, Professor Pradana, Dr. Tahapary, Dr. Kurniawan, but also with people from the Universitas Hasanuddin, Dr. Wahyuni, Dr. Hamid, and Dr. Amaruddin. Recently, the Leiden University Medical Center also set up a campus called The Hague, where it's completely focused on population health. And we recently installed an international exchange program for students called LUMC Global. Next, please. I'm interested in respiratory diseases as an example of an inflammatory disease. In particular, in young age, well-known examples are airway allergies and asthma. And we have seen that they are increasing over the past 70 years with large differences between rural and urban areas. And as explained by the previous speakers, also for these respiratory diseases, the causes of disease are related to an urbanized lifestyle, resulting in reduced contact with biodiverse environments and a poor microbial diversity. And this in the end leads to the immune maturation in early life being affected and a tolerance induction to allergens and in the end to respiratory health. We have learned from the Global Health Initiative in Finland that when you promote microbial exposure and diversity in early life, that you actually can reduce allergic diseases. But at the same time, we know that we have to improve air quality and we have to think of ways of taking back nature to modern cities. Next, please. Within our studies, we put the immune system in the spotlight, and we have adopted technologies that allow us to study the immune system on a single cell analysis level. For example, the mass cytometry, which is shown here in the left, where we can use, where we can phenotype cells with 40 different markers at the same time, but also we can analyze the gene transcript on the single cell level with single cell transcriptomics. We not only focus on immune system measured in peripheral blood, but we are also interested in immune responses at mucosal areas, and we have adopted techniques that are applicable to field, where we can also sample the mucosal areas such as the nose by nasosorption or by curettage. Next slide, please. So in our studies, we are aiming to compare rural-urban transition. And for this, we are studying cohorts in populations that migrate to urban areas. And here we are interested to study respiratory health in relation to immune maturation. And to be able to study respiratory health, it's also very important to study lung function by using spirometry. And as the previous speaker also indicated, to sample air and study the air quality in relation to lung function. At the same time, we are interested in studying immune maturation, both systemically in the blood, but also at mucosal surfaces in the nose. And it's very important to relate those to other social, cultural, environmental, and urban planning data, as has been detailed by the previous speakers and will be further explained by the next speaker. Thank you very much. Next slide, please.
Good morning, everybody. My name is Arjen Speksnijder. I have a research chair at the Leiden University of Applied Sciences, co-financed by Naturalis. I have a background in medical and environmental microbiology and epidemiology, and nowadays try to develop techniques for measuring biodiversity, and I will explain later. Next slide, please. This is my slide, which next slide, please. So as all previous speakers show the problems we get with an urbanizing environment and all the challenges we have, I think that the biological component can be very important for your immune system, and biological immune challenges in the air can be like a common denominator if you want to do research and combine environmental exposure towards and human health. The key technology in this is metagenomics. Why metagenomics? It's a universal way to measure biodiversity, and we do that by DNA. Next slide, please. To give you a bit of an idea, what we did in the past at the Applied Science University is we developed personalized air samplers, which you can put on your bike or top of your car or use in your house. And by next-gen sequencing, we can see, analyze the DNA, which is captured on slides in this machine, and make biodiversity plots of your environment. It's a general technique which you can also apply in water, soil, but also in human gut and so on. So it's very dependent on the way how you sample, but downstream next-gen sequencing analysis is quite universal. Next slide, please. So what I want to propose in this session is that we put environmental biodiversity in the human health equation by using this technique, which of course has its biases, but it also has its advantages. And I also want to see, or if it is possible to do that, to set up these techniques and train people locally in Indonesia. And that's for me open to discussion further up in this session. Thank you very much. Next slide.
Assalamualaikum. Hi everyone, I'm Sitti Wahyuni from Hasanuddin University. Next slide, please. Hasanuddin University is the largest university in South Sulawesi. We have 14 faculties, and medical faculty have a facility for teaching hospital. We have a big teaching hospital, Hasanuddin University Hospital, and Wahyuni Sudirohusodo Hospital, as well as Center for Medical and Health Research Activity. Medical faculty have a collaboration with institutions in the Netherlands, especially LUMC. We have already have collaboration since 1980s. And then also we have collaboration with Maastricht University, Amsterdam University, University van Amsterdam, Amsterdam Medical Center, and Utrecht University. And with the local, we have collaboration with South Sulawesi and Makassar health offices, school principal and teacher, and also with other faculty in Hasanuddin University. Slide, please. Makassar is the capital city of South Sulawesi province, has an area about 176 kilometers square, consisting of 15 districts. A total population about 1.5 million with density level 8.6 thousand per kilometer square. The poor population in Makassar is about 65,000. In Makassar, there is a large variation in environmental exposure and health outcomes within the area. From previous study done in high and low socioeconomic school, we found a difference in parasite infection, nutritional status, immunoresponses, and disease. Slide, please. Recently, we profiled the fecal bacterial community of 140 Indonesian school children in urban Makassar to understand the relationship between the gut microbiota and the health profile of Indonesian. From the study, we found children in low socioeconomic school is marked by higher Helminth and protozoa infection, but lower nutritional status compared to the children with high socioeconomic status children. Multiple bacteria genera were differently abundant between high and low socioeconomic school children. The microbiota of high socioeconomic children was less diverse and strongly associated with body mass index, while in low socioeconomic school, parasite infection associated with several populations of microbiota. The study found that Indonesian school children living in urban Makassar share a core microbiota, but their microbiota varies in diversity and relative abundance of specific bacterial taxa depending on socioeconomic status, nutritional status, and intestinal parasite infection. Next slide, please. Next slide. Please, next slide, please. Before. And then in Makassar, also we see urbanization. And then the question is within one urban area, because we have a lot of variation for the socioeconomic status, the question is within one urban center, how are biodiversity and socioeconomic status linked? How does biodiversity affect the microbiota of the resident? How does this affect the immune system and disease outcome? And the future agenda is to see the effect of placebo control trial, to see the effect of albendazole on gut permeability or intestinal damage, gut microbiota and gut barrier function in stunted children, either in school children or young children, and to see probiotic and food intervention and gut microbiota profile in young Indonesian children, stunted versus not stunted, and the effect of healthy life or behavior intervention on microbiota profile in different population of children. To unravel this, we need collaboration with LUMC and other institutions in the Netherlands. And we also need collaboration with other disciplines like medical anthropologists, environmental scientists, architects, public health, and social science. Thank you.
Hello, good morning or good afternoon, depending on where you are. My name is Nelson Mota. I'm Associate Professor of Architecture at Delft University of Technology and a member of the Global Urban Lab, part of the TU-Delft Global Initiative. Next slide, please. Delft Global actively supports researchers and students working on solutions that contribute to reaching the United Nations Sustainable Development Goals, with a particular focus on Sub-Saharan Africa and Southeast Asia, always working in co-creation with local partners. The Global Urban Lab includes researchers from different disciplines, namely architecture, urbanism, and civil engineering, which rank at the highest levels in the world, second both in architecture and civil engineering, according to the QNS subject rankings. Next, please. As mentioned earlier, Indonesia has one of the fastest urbanization growths in Asia. In 2017, about 144 million Indonesians lived in urban areas. By 2045, this number is estimated to grow to 220 million. This means approximately 80 million more Indonesians will live in urban areas. To put it in perspective, this is the equivalent to adding more than 4 times the current population of the Netherlands in less than 30 years. This urbanization rate is a matter of concern for biodiversity and health. Many studies show that phenomena related with rapid urbanization, such as sprawl, increasing population density, bad construction bylaws, and inadequate urban policies and design are causing serious health problems in urban communities. Research shows that the incidence of communicable diseases such as tuberculosis or non-communicable diseases such as diabetes type 2 increase in urban settlements that lack adequate architectural parameters to promote good ventilation and access to sunlight in dwellings, and urban parameters to ensure that there are adequate safe spaces for active living for both children and adults. Next, please. To study the spaces and livelihoods of rural and urban communities, our group combines quantitative and qualitative research methods to harvest data about the performance of buildings, urban spaces, and domestic practices. These methods include, but are not limited to, environmental analysis, for example, measuring light and ventilation, but also morphological and typological analysis, for example, measuring density, floor space index, and ground surface occupation, and also visual ethnography, mapping behavioral patterns. Next, please. Next, please. The relation between the characteristics of the built environment and disease patterns, previous, please, may be investigated using correlations between architectural and urban parameters and indicators of disease. Before, please. To address the challenges of rapid urbanization in Indonesia, we propose a comparative study of disease and domestic patterns in rural and urban communities to determine which are the main factors of risk and potential solutions to prevent diseases caused by poor urban planning and housing design. The study we propose will include 3 components. First, comparative mapping of environmental conditions and patterns of everyday practices in rural and urban and residential neighborhoods. This study will use several methods and techniques such as 3D scan, geo-tracking, interviews, and visual ethnography. Second, study the correlation between disease patterns and patterns of inhabitation. And third, identify best practices in the design of residential neighborhoods to prevent negative impact of urbanization. Thank you. Next.
Sorry. Okay, so I would just like to thank everybody, also the technical people who've been solving our problems. I'd like to thank the speakers. And as co-chair of the session, I will summarize and discuss the next steps. I'm Maria Yazdanbakhsh from Leiden University Medical Center, and I have had the pleasure of working with Indonesian institutions and colleagues for more than 30 years in a harmonious, respectful, equal, and win-win partnership. Next slide, please. During the pitches, we have dwelled upon urbanization. As ministers mentioned at the opening ceremony, 50% of Indonesians are living in urbanized areas. This brings economic opportunities, can improve living conditions, but also rapid urbanization brings about inequalities, different health problems, and very importantly, loss of biodiversity. Biodiversity not only in animals and plants, but also in microbes. Microbes on our skin, in our airways, in our gut, they are very important for our health. They keep our metabolism, physiology in balance, and they are essential for the functioning of our immune system. 2 days ago, a paper in Science appeared, which indicated some very novel bacteria on our skin are producing antibiotics to fend off harmful pathogenic bacteria. Loss of biodiversity can really affect our health. We want to work together to find solutions. And for that, we don't only need doctors, nurses, health workers, but we also need biologists. We need basic scientists, as well as behavioral and social scientists. Importantly, we need engineers and planners to work in our team to design buildings that are reducing burden of diseases in a very clever way. We want no more deaths from dengue, malaria, meningitis, chronic diseases, no malnutrition, no stunting, but also no obesity or cardiometabolic diseases or asthma. It is important to work together in a multidisciplinary team. It's really, why should then the Netherlands and Indonesia work together? Well, our common history, bitter and sweet, has created bonds. As our minister said, people in Indonesia are keen, interested in the Netherlands, and people of the Netherlands are interested in Indonesia. But there are also other issues that will create a win-win situation. As Professor Koch mentioned, we have hardly any biodiversity in the Netherlands, but Indonesia is rich in its biodiversity. We are fully urbanized, but Indonesia has the great expanse of rural areas still. We learn a lot and can devise measures to improve health by examining rural-urban transition. Indonesia is evolving really in a real time, very rapidly, and this creates excitement, energy, and opportunities. Our students visit Indonesia and they learn a lot about diseases and that they've never seen before, and they learn about how to care for patients. As Minister Engelshoven mentioned again, we can learn from Indonesia about vector-borne diseases and their control. And Indonesia can learn from the Netherlands how to improve healthcare system, new methodologies and technologies, e-health, m-health, among others that are important for health and biodiversity in an urbanizing world. Can I go, please, next slide? We want to do specifically in a win-win partnership to measure relationships using cutting-edge tools. We've shown that. We would like to work in an interdisciplinary team and design preventions to pinpoint causality. We're hoping to discover innovative and sustainable, but also affordable approaches for both countries. And very importantly, we want to improve education. As the minister also mentioned, Indonesia wants the universities to rise in ranking. We can contribute to that, and our findings will have impact through influencing policy. And we believe together we will achieve more. Not only the old, the younger people should really get together and improve our future. Next slide, please. We are open to new collaborations. Come and help us, people who are in the audience, to connect the dots of urbanization, health, and biodiversity to improve health for all. We need things like CSOs, we need maybe new industrial partnerships and other expertise where we not yet have completely covered in our consortium. So we're very happy to welcome you all. Thank you for your attention. And I think we'll open the session for any questions that are there. Other technical people are going to show us the, I can open the chat box. Are there any questions? I am not sure if I can see. The session is open for questions. I'm not sure if people can unmute themselves. You can also write in the chat box. Are there people in the audience who would like to join this consortium? Do they find gaps in this consortium? And otherwise, any of our consortium members, do you have any questions?
I can start a question. From the science and education point of view, how do you think it is possible, or how far, in what extent can you have the techniques, the cutting edge techniques implemented at Indonesia?
I think it's for Tanya. Would you like to answer this? My co-chair from Indonesia. I think Indonesia is really at some centers already implementing many technologies, but I think this really brings one important point: data, big data analysis. Capacity to analyze data can overrule the technological assets. If you can measure something all over the world, but it's the data analysis that will really enable you to have the ownership of the research, for example. Tanya, what do you think about the technological possibilities? If you'd like to add, and maybe Dr. Yodi and others from Indonesia, please. Tanya, do you have anything to say?
Actually, for us, this is new to combine a different discipline of knowledge. I agree with Maria that we have to analyze a lot of data from rural and urban because, like in Indonesia, we have a lot of island and with different culture, and of course they have a different style living of lifestyle. So I think it's good to combine the rural and urban in Indonesia compared to the Netherlands. Yeah.
And maybe Dr. Yodi, Dr. Wahyuni, do you have any? Dr. Dicky?
Yeah, just to add, so it depends on which cutting edge tools we're talking about. As Prof. Tanya has been referring to, when it comes to discipline specific tools, many of us have that capacity, but here we're talking about transdisciplinary challenges, and also many of the tools we're seeing are not something which comes from our disciplines. So that's something which is new for us. And also this big data, it's something which is evolving here as a capacity. We are also doing things to increase our capacity to also to analyze big data, but that's something which is still evolving. That will be my contribution.
Okay. Anything, Dicky, Wahyuni?
Someone raised their hands. I think it's not.
But I was wondering whether Dicky and Wahyuni have any contribution as partners in this consortium to add to this. If not, it's fine. But
not for now, Maria. Thank you.
Okay, Wahyuni, anything to add?
I'm interested with the the nasal swab that will arranged by Hermelijn. It is, I mean, we want to do that. It is not danger for the people, because since probably we'll collect samples from the one who are not sick or have no because but it is, can you explain about how it works?
Oh, well, I mean, this is going into detail, but
Yeah.
we were talking about technologies needed, but definitely these methods have been implemented in many parts of the world. They are definitely done in Europe, USA, but also in several African countries. It's now entered for diagnostics and also for analyzing the microbiota and the immune system interactions. So we can discuss that in more detail maybe later, if that's okay. Yeah, there was a raised hand. Please unmute and ask the question.
Hello. My name is Helmi. I'm a PhD student in Gadjah Mada University. I'm also acting as one of the coordinators in Atlas Village COVID-19 hospital in Jakarta. We are talking about now about urban and rural biodiversity in let's say in healthcare. We are dealing a big problem recently about this matter in everywhere, in every country, especially in Asia, of course. And this also has been our challenges, how to keep the spread of the infectious rate not keep rising and keep peaking at all times. So we are very concerned about.
Yeah. So would you like to hear how we could contribute to that?
Yeah, sure. Especially in healthcare workers and also healthcare policy, for example, that's more important because we not really understand how to deal with this. Thank you very much.
Thank you. Dicky, you have some expertise, but I can just say that by, of course, testing, tracing, and isolating people is the way, but this is really something that brings in how difficult it might be in a very urbanized center, which is very crowded, and social distancing is almost impossible. And also, you know, having capacity to produce your PPP gear is really important, of course, as you know. But Dicky, would you like to, and our studies are really, would be asking, what is it that contributes, like Dicky said, you know, if you have cardiometabolic diseases, obesity, that's really a risk factor for COVID. So that's how he will be studying to see how you can maybe combat that, develop new methods, new medicines, new vaccines to deal with that. But at the behavioral and social level, that's something that I think many countries are struggling with it and need to really learn from each other, also in terms of behavioral sciences, like was mentioned at the beginning. Dicky, would you like to say? Sorry, would you like to say something?
Yeah, thank you, Maria, and thank you, Helmi, for the very nice question. I think we all agree that the problem with the COVID spread is not only related with the medical problem, but also more complex because of social, also anthropological problem as well. Because in terms of the treatment, of course, we don't have many options right now, but of course, most of the case, they are self-limiting, of course, mild, but we also see severe cases. So that's why it's very important to find which one will develop severe cases so we can, of course, tackle this early on. And one of the main predictors for severe cases is the cardiometabolic diseases. That's why you want to really study how can people with diabetes, for example, with obesity, can develop these severe cases as well, from the clinical point of view and also from the immunological point of view. And then we also very interested to compare this between urban and rural as well to see how the different immune response between urban and rural will affect the response to COVID-19 as well. Of course, you have the issue with the healthcare facility as well. Of course, in Jakarta, for example, you see there is a really well set up healthcare system. While, for example, in some rural area, you don't see those luxury. But of course, but still, we want to compare whether maybe some immune response in rural area to several pathogen might also confer some maybe protection or less risk for infection or less risk for severe cases of COVID-19. But we still on the beginning early phase, so we still need to do a lot of research on this matter. Thank you, Maria.
Anyone else would like to contribute to this? Dr. Yodi?
Okay, yeah, I could try. I mean, what we're seeing with the problem of COVID in Indonesia, I think many of the issues are way beyond medicine, way beyond technical issues now. Many of the phenomena of these rising cases, it's also related to many of the different conflict of interest. I mean, there are so many interests involved, economic, health, and that's what we see now. I mean, from the medicine side, from public health side, we have our own aims, but the economic people also have their own interests. And sometimes that's conflicting. So it's an issue of leadership, it's an issue of coordination, and that's way beyond medicine. I mean, we have the technical interventions, but that's not enough. Even if we have the vaccines, that's not enough. We also need a lot of this policies, all of this leadership, coordination, and governance in place to be able to make sure that interventions are actually implemented effectively and reach those who are most at need. So it's way beyond medicine, it's way beyond technical matters, and it's a lot about politics, social, and economic. And that's why we need transdisciplinary approaches like what we are introducing here in our consortium. Thank you.
Thank you very much. Yes, do we see Sophie? I see one hand, sorry. So would you like to, yeah? Please go ahead.
Hi, thanks. I actually had a follow-up to what Yodi just said about the consortium and the political and governance aspect of it all. To what extent is our governance parties already included in the consortium? Because just to move away a bit from the COVID and back to the things that were presented today, I think it's very nice to collect all the data and very important, but there's also a lot of data still available. And I think at some point there needs to be implementation, right? So from the start, it would be good to connect with the governance parties that will actually do something about the traffic congestion that's causing the problems in birth mothers or in people living in cities. So have you thought about, is that part of the consortium yet, or should we still look into that?
I think we are strong in terms of, I know that Tanya of the Yodi, Sitti, Wahyuni, they all in their areas are working with the local governments, and that's a very important start. I think that's probably, if we are saying we are also learning from Indonesia, that is actually weaker for the team here. We're not as well connected to policymakers. So definitely something to learn again from Indonesia, how they move this forward. So very good point. And I think that's why on the last slide, it was like, we need people to join our consortium because we do have some gaps. But yeah, I don't know whether others, Kerstin, would you like to say something, or Nelson, Arjen?
Yeah, I would very much like to say something. I very much like to compliment you, Maria, to bring together actually all the colleagues who have been showing today the collaborations they have in Indonesia, from Dutch side, but also the Indonesian colleagues, the collaborations they do have with Dutch colleagues and Dutch institutions. And I think, what we've been able to showcase is now I would say, it's impressive, all the work that has been undertaken, that is currently undertaking. And so we are in an excellent position to really create a large network that does not only help us to undertake excellent research, but also to translate the research findings into policy and practice. And as you just said, Maria, I think we can learn a lot in that regard then from our Indonesian colleagues. So thank you very much for bringing us all together today.
Thank you. And Hermelijn, would you like to say anything? Sorry, can I just, because I've been using her facilities. Please go ahead.
Yeah, so I can just echo what already has been saying. I think it's very clear that in this situation we can actually learn a lot from Indonesia, how they have managed the interaction with the local politics, and I think that's clearly something we should more focus on in the Netherlands. And I think by having this consortium that makes you aware of the possibilities there, and that it's really important to take those steps to bring these concepts further, because otherwise we keep on generating new data in our own circles. But we have to bring that to the one level outside. If you throw a stone in the water, then you have all these circles, and we have to bring it to the next circle to be able to integrate this. And I think it's also an important aspect is a teaching aspect. Also to have new students coming up, to get them involved and make them aware. Because I mean, I was never taught like that when I was at university, but now we know, so we have to implement and we have to make our students aware of these principles. And I think also in the Netherlands now there is more and more with the Dutch science agenda, for example, that they really try to focus on having multidisciplinary teams and thinking about implementing. So what is your impact plan? And I think that all these types of initiatives are really important to take that next step and to really make an impact. So I think it's a very good point.
Thank you. Nelson, because Nelson, it has been a pleasure to be working with architects, which is a great thing. And then Arjen, maybe, please go ahead.
Yeah, indeed, I think that Sophie's point is crucial, because for in terms of construction bylaws and all the regulatory framework that influences urban developments, we see that sometimes there are embedded, aspects that will influence the quality of life, and then and eventually also the, let's say, the biodiversity. But we don't usually look into those kind of aspects as determinants of the consequences of our, let's say, or to make them to make more healthy and more inclusive cities. So in that case, indeed, having someone that can also bridge the connection with the actual implementation and with let's say, with decision making in terms of the regulatory framework is also very important. So indeed, all this say consortium will benefit definitely from engaging with stakeholders that also have a say in terms of implementation.
Thank you. Arjen, you wanted to add something?
Yes, so if we recognize the importance of biodiversity, we certainly should look back at the plenary session from yesterday, where you have the key players in policy making of biodiversity in Indonesia and in the Netherlands. So maybe look at that list of names, and maybe we should involve one of those key players from Indonesia and also from Naturalis, maybe Koos Biesmeijer, to give their view on this initiative.
Yeah, absolutely. It was a wonderful session, actually. I don't know if people attend some, but there were some very important people there to connect with, and definitely for the joining of the dots. Katja, you've been helping shape this. Would you like to add anything? The triple burden, we haven't really discussed nutrition very much. You have to unmute, maybe.
Sorry. I can add on what has been said before, and I think it was clearly explained by Yodi that, you know, whether we talk about urbanization or COVID or the triple burden, or those are all very complex problems, wicked problems, they call them. And the only way to deal with them in a effective way is just to use systems approaches. So that means that we just have to have all these disciplines and they start working on that problem from the beginning. So you don't, not at the end, but also the policymakers, we start with them from the beginning and all the other disciplines. So I think we are well on our way with that. But, and we can, like Arjen said, biodiversity people and also maybe some others, maybe social scientists that could really be an added value to our consortium as well.
An economist maybe as well.
Economist, yes.
Yeah. Okay, I'm not sure from the technical side because of the problems we had. We started later, but it is already 10:06, and I guess the next sessions are starting, and people might want to attend the other sessions. If there are any comments, please raise your hand, and if not, maybe we should wrap up. I don't see any hands raised.
I think I'm already raised my hands. It's Helmi again.
Yeah.
Sorry, I'm working in the center of Indonesian hospitals in COVID-19, and we are really lack of experts in research. We have plenty of data, and I don't think we are experts in dealing with the data. Also, we have lack of experts in guiding us to have a good management system in this let's say disaster or field hospital. It would be great if you could involve it to guide us as a consortium. I would like to welcome you all. I can maybe try to help how to get into the Ministry of Health, or maybe the committee of COVID-19 in Indonesia, if you would like to. That will be very delightful. Thank you very much.
Thank you very much. So I hope this is a moving activity that we can we'll make a report and send it to our respective country responsibles, maybe to ministries, to grant giving agencies, to try and stimulate the actual happening of projects. So we'll definitely take up your offer, Helmi. So, and with this, I'd like to thank everybody so we can move to the next sessions. It was wonderful, and I'm looking forward to the fourth get together. On behalf of Tanya also, thank you for introducing and welcoming us all, and have a safe day, weeks, months, years. Thank you very much for joining. Bye-bye.
Thank you.
Bye.
Bye-bye.